And almost everyone says, like, I have a hemorrhoid. I'm like, well, what does that mean to you? Is it bleeding? Is it itching? Is it redundant tissue? And then after we kind of get a sense of what your symptoms are, then I do an exam. The way I do an exam is first I look on the outside, looking for things like infection collections, which are pretty rare. Usually, if someone has a big sore in there, they know about it. They tell me about it. Looking for things like fissures, which are small cuts in the anal canal that can cause an extreme amount of pain during bowel movements. I have to credit a dear patient of mine who described it as like pooping a pineapple, right? Like real spiky, real sharp. Then I look at the caliber of the external skin. So is the external tag, is it part of the skin itself? When I retract or pull on it, does it bring down internal hemorrhoid tissue, kind of concerning for prolapse? Are they all over, like circumferentially around the anal opening, or is it in one location versus another? Is there thrombosed external hemorrhoid, which is a blood clot on the outside in that skin? Those are extremely painful and they look really tender. And then after that is a digital rectal examination, which is an examination with the finger, feeling for any masses or irregularities, nodularities, changes in the mucosa, which is the tissue lining the rectum. I always feel for muscles of the pelvic floor to evaluate for tenderness there or pain. And then I use a small scope called an anoscope. It's just a couple of inches long, just a little bit bigger than my finger, and it has a side slit that allows me to look at the hemorrhoidal tissue itself.